Go on to our Centric Health segment. We've been talking a lot about the coronavirus and just the pent-up desire of all of us to return to some degree of normalcy. I surprised myself last night. Yeah, yesterday afternoon. Ran a couple errands, and I did it twice. I left my mask in the car. My mind is already it is racing toward normalcy, even if we're not there yet, because I have had my 2 shots. Maybe I'm feeling invincible. I hear good news. The President Biden has said we're going for 200 million vaccinations in the first 100 days. Everything seems to be working, at least here. I just wonder if we are being premature about this. That's why I'm anxious to talk to Dr. Bridge Bomby, President and CEO of Bakersfield Heart Hospital and one of the officers of Centric Health. Dr. Bomby, how are you, sir?
Richard, I'm well. How are you?
I'm doing great. Tell me about, have you had a sense, and I know last week when you were on, you said that you and some couples who had been fully vaccinated, you were going out to dinner. I trust that went well. Do you have the same sense that I do, that something in my mind is so ready to push fast forward to get to normalcy that I might be jumping the gun a little bit?
I think, Richard, it's a tale of two cities. The first half, there was a scarcity of vaccine and a lot of people wanting to have the vaccine. I think the table is going to flip now. There will be surplus of vaccine and vaccine hesitancy becoming a problem. So there will be a disparity in the opposite way. And that's really the concern I have, is we can't, you and I have been vaccinated, but we can't say that's mission accomplished. Mission is accomplished when sufficient of us are vaccinated to disallow the virus to jump from one to another, the thing called herd immunity we talked all the time. So yes, the people who've been vaccinated, they feel liberated. And the people who are not vaccinated, it's for them to carry the torch now and get vaccinated. As the supplies increase, it's necessary the eligible population, which is pretty much everybody, even the kids are getting vaccinated. Moderna and Pfizer have started those trials. So as long as we achieve 70-80% of immunity through both the means, natural and vaccination, we should be okay. But if we don't reach that threshold, Richard, I concern myself that this is a global threat, and even if we have a local inoculation and immunity, the threat that the virus is going to continue to hold out in other areas and evolve is a threatening possibility down the line for all of us. Another thing, if the virus goes off the tangent and goes to the animals and comes back again, that creates another adverse pathway for the virus to mutate in a dangerous manner and start the game all over again. Yes, I share with you the enthusiasm built both on vaccination and frustration of smothered life to go out. But it's premature to declare success. The success in this country depends on vaccination, and in the world, it depends on us, U.S., and the other rich country shouldering the cost of vaccination, because if we don't eliminate the virus or curtail the virus, it's going to come back to us. And my concern is in a iteration that's even more evil than the current one.
Oh, boy. It's probably a bad analogy, but it sounds like, when we talk about global warming, when I hear people talk about, well, we need to do this and this and this in this country, and my response is, well, that's great, and I have no problem with doing XXX, but what does it mean if we do this here and China adds 150 coal plants in the next 10 years? Because it is a global problem. Tell me, if you could, Dr. Bombi, precisely, let's assume that the U.S. reaches some degree of herd immunity, okay, and we're doing well, but vast parts of the planet do not, and the virus continues to mutate. Are you saying that we could get a strain could develop somewhere else that would come back and it would be COVID-19 all over again, that whatever immunity we have from COVID-19 would not work against a new variant? Is that the danger?
That is the real danger, but your analogy about the global warming and coal plants in one country versus another one is an apt one, because if you don't do it as a world, nothing happens to the world that's positive. So that's really the fear, that this COVID-19 virus is a very smart evolutionary piece of RNA, and it has already done everything in a more efficient manner for a pathogen its age or its exposure to humans. Yes, that's the concern, that it can evolve into a much more contagious and virulent variant that will escape our pre-existing or accumulated immunity and will be back to square one. And I don't know, Richard, if you paid attention today. I found it very provocative. There was a teaser on CNN about Dr. Robert Redfield, who was previous CDC director. And if you recall, we had this conversation many months ago about the origins of the virus. At the time, we talked about the Wuhan having a lab where these viruses are hosted, and they do research on them. Dr. Redfield made a comment about the biologic behavior of this virus. What he said was that the viruses typically, when they jump from animals to humans, have a long lag period. So they don't typically start a pandemic right off the hook. The fact this virus was so contagious to begin with is a reflection of the fact that they were trying to tweak the virus in the lab and thus jump generations of biologic behavior. And when it likely accidentally infected a person in the lab, that person took it out. And according to Dr. Redfield, the timeline goes back to September, October. So there are two components to that. One, the Chinese government, they never allowed an independent investigation into the origins of the virus. And secondly, going forward, which is even more important as we are struggling with the current pandemic, is to prevent the next pandemic, to have that ability to have a preemptiveness in pandemic monitoring. Because when a virus starts infecting, to the time when it's detected, there's about 2, 3, 4 months. And by the time it has already done enough damage and it needs to be contained. So a lot of futuristic endeavors have to be pandemic preemptiveness, where we look for the hotspots where the interaction between the animals and the humans occurring in remote villages, and the genomic sequencing for any infection is being conducted. Because even if you have, Richard, let's say a more virulent or more contagious pathogen, as long as we can recognize it closer to its origin before it spreads too far, we can create a perimeter around it, and we have the platform technology of messenger RNA now to create vaccines about it. But we need to be able to detect a new pandemic, a new variant, and then bury it by creating a perimeter around it. But what Chinese government did, they disallowed us that opportunity, and according to Dr. Redfield, they knew all about it.
Wow, does that sound Does that sound logical to you that number one, they would be working on a live vaccine like that, and that number two, it could escape? And would the research on the vaccine just be for research purposes only? Because if you remember early on, there was a lot of talk about, was this like a kind of would it be used as a weapon? Why was China developing this? Would this be some kind of viral warfare agent or that? Is it normal for in these research labs to be looking at vaccines like that and tweaking them?
So all these stage 4 labs, they do that because that's what the virologists do. They have these pathogens, they tweak them, and they study the behavior, and it's part of science understanding and preparation if there is any infection that occurs. But what happened in this case was there was a cover-up, there was a deception, and there was denial. And this is almost a year and a half now, and we still don't have uninterrupted access to that. They have cleaned and scrubbed everything else during this period. So yes, can it happen? Of course, a virus can be tweaked in the lab, not for malicious intents, but for scientific, and it can escape. Mm-hmm. So nobody's ascribing, okay, there are some people who are ascribing a malicious intent, but the possibility that it escaped the lab and infected people inadvertently, accidentally, is a real one. That's a real possibility.
Wow! It's terrifying to me to some degree. What would you, from your perspective as a medical professional, when you open the program saying, look, this is a global problem. It's great if we can reach herd immunity locally, but the long-term game is really getting the entire world vaccinated. What would make you, what do we need to do as a country or as a people to join that effort? Is this a matter of the industrialized world just sending vaccines to the developing world to get this done? How are we going to, what would make you happy about this?
The world as a whole has changed because of the travel, the airplane. So nothing can stay compartmentalized. It's truly a global village now. So I think it's incumbent upon the people with means to reach out for people with lesser means, because at the end of the day, it's not a charitable act. It's a self-preservation act, because if the virus comes back to us in a more venomous form, we didn't gain anything. We need to go on war footing in scaling up the production of the vaccines and delivering it across the world. And the cost of that is going to be a few $1 billion. The cost of another iteration of the virus, which is more malignant and virulent, is going to be trillions of dollars. So the return on investment, both on a humane perspective and from the economic perspective, is huge. So the COVAX program that a lot of the governments are joining is a good one from a selfish standpoint and from selfless standpoint.
Interesting. No, well put. We're talking to Dr. Bridge Bombi of Centric Health. Dr. Bombi, there's been a lot of discussion, good discussion about inequities in the distribution, whether it was intended or not, inequities in the distribution of the vaccine and in the access to health care. Lots of talk about disenfranchised, poor areas not being the last on the list to get the vaccine, a disproportionate number of people of color becoming sick and possibly dying from the vaccine. From your perspective, when you look at this, what does that point out a flawed healthcare system, or is this a flawed political process in how to roll out this vaccine?
I think it's a combination, Richard, but what we can say undeniably is that the richest country in the world had the highest infection rate in the world and highest death rate in the world. We have 550,000 people dead. and we have to be honest about it. Why did we have so much death and destruction because of the vaccine, because of the virus? And the reasons are pretty clear. And if you can tease through them, most of the deaths occurred, one, in nursing homes. So our elderly people were not well protected. In poorer countries, there are multi-generational homes, so the people are separated out. So here we had vulnerable people who were pretty much captive and were exposed to the virus with the fatal results. The second was in populations which are at the lower end of the socioeconomic cadre, both from health and also from education perspective, the accumulation of diseases in that part of the world includes obesity, diabetes, hypertension. So an aggregation of diabetes, high blood pressure, congestive heart failure, all those things added up to that. If you take out comorbidities and older age, the COVID-19 hasn't been too dangerous. It's only in elderly and with comorbidities that it's very bad. But that seems like a winning proposition, except 60% of the people under the age of 40 in this country have one comorbidity. So it's not like we are a very healthy nation.
Okay, you got to say that again. I want to make sure 60% of the people in this country
under the age of 40.
Under the age of 40 have a comorbidity?
Have one at least one comorbidity.
Give me an example of some common comorbidity. Diabetes?
So, obesity, diabetes, hypertension, COPD. Those are the common comorbidities. I think most of them are nutritional. They're life behavior related. So the one light this virus lent was for us to change our behavior. If we can improve our diet, improve our exercise, we will be much farther ahead. So between the education and economic disparity, we accumulate nutritional deficiencies, probably related to education. We have less exercise and obesity. So a lot of those things, the education is going to be extremely important to decrease the vulnerability of this population, of this nation, to be better prepared for the next pandemic. And even now, what is the pandemic? We have a pandemic of heart attack and strokes in this country, right? So that's also contingent upon our behavior, diet, exercise, diabetes, hypertension, compliance, and not smoking, things like that.
Isn't that amazing that when it gets down to it, and we don't talk about it. We don't talk about how our own behavior, whether we're obese or diabetic or whatever, can make us more vulnerable. I mean, this whole discussion of the coronavirus was, I don't want to get it, but there's really not a lot of discussion about, well, if I get it, I am 70 pounds overweight and I do have diabetes, and what that would do, and what I wonder what, if we lived in a society with, with significantly fewer comorbidities, what that 550,000 deaths would look like. It would be significantly lower, wouldn't it?
It would be. If you look at a country like India, they have about 100 per million deaths. In a country like U.S., we have 1,600 per million deaths.
Wow.
So, and we have to ask ourselves why. It's obviously, if it was purely economical, the death rate would be much higher in India. It's conceivable that their average age is much lower, so that younger people tend not to have much severe disease. That's a component. And the fact that they don't have much nursing homes there, and their multi-generational homes, eliminates a congregation of vulnerable and under one roof, and thus being exposed to those consequences. But I think obesity, lack of exercise, sugar intake, and all the fast food, that's really engineering the healthcare. The pandemic of ill health in this country is related to that.
Boy, there you go. That's the lead, the pandemic of ill health in this country. Dr. Bridge Bombay, always great talking to you, my friend. I always learn something. I hope you have a great weekend, sir. Are you going to go out for another dinner with friends out on the town?
No, the duty beckons. I'll be back on work.
Okay. All right. Dr. Bridge Bombay, have a great weekend, friend. Thank you.
You too, buddy. Thanks.